Hi everyone, thanks Matt. My name's Katharine See and I am the Chief Health Outcomes Officer and Director of Respiratory Medicine at Northern Health, where I lead the Clinical Leadership, Effectiveness and Outcomes team. So we are essentially the value-based healthcare implementation team at Northern. And so we're responsible for outcome collection through digital care pathways, redesigning models of care to increase interdisciplinary collaboration across the care continuum, and finally implementing new technologies with the goal of better outcomes for individuals and better health for populations. Just a small piece of work. And so I'm here today to talk to you about our Outcomes for Impact strategy, which is our value-based healthcare strategy at Northern. So I think we all know that our healthcare system is completely overwhelmed. We've got spiralling costs without commensurate improvement in outcomes. And digital substitution alone is really inadequate to address these problems. So I think the Victorian Virtual Emergency Department is an excellent example of this, a fantastic service providing care to almost 1,000 patients a day. And yet our physical emergency department is bursting at the seams and our hospital is way over capacity. So what we really need is transformational change in our models of care. But how are we going to achieve this with a workforce that are profoundly fatigued, burnt out, and feel as though they're pretty consistently being asked to do more? Why do you come to work? It's a really important question. When I ask it, a lot of people say to get paid, which is fine. But it's important to acknowledge that there is a growing disconnect between the values that attract people to healthcare and their experience of working in the sector. I'm a very purpose-driven person. I come to work every day to make a difference, to help people. But how do you know that you do a good job? When I ask this in our workshops, people usually say, oh, I get feedback from my patients, we have morbidity and mortality meetings, we've got audit, and that's great, but is the absence of doing harm the same as doing good? I would argue that most of us don't know if we're doing a good job. And that's because the challenge we have is that healthcare administrative data, while it meets all of our regulatory and reporting requirements, provides very little insights into the actual outcomes of care for our patients. We do have registry data, as Matt said, but that's mostly process metrics, quality indicators. There's very few outcome measures there. And it's often outdated by the time it's provided to health services. So I've only recently received the 2022 Victorian Lung Cancer Registry data. So how my service performed 2 years ago is really of very little interest to me now. And so how can we support our clinicians who are keen to understand the impact and performance of their service to make data-driven decisions? Well, we could start by measuring what actually matters. When we measure outcomes, it tells us how we're doing with respect to providing healthcare. It allows us to identify opportunities for learning and improvement, really driving that learning health system. It gives patients and families critical information about what to expect when they seek care from us, supporting high quality shared decision making. And it allows us to identify preventable patient harm, variations in care standards and outcomes, and disparities in health results based on race, ethnicity, and other social identity characteristics. So at Northern Health, we began measuring with lung cancer. I'm also the lung tumour stream lead. Our former CEO's idea of value was just to give me as many jobs as was humanly possible. We started our tumour stream in 2018, and since that time we believed we were doing well based on benchmarking with the quality indicators. However, we had no way of actually measuring our patients' outcomes. So thanks to a generous service improvement grant from AstraZeneca, we launched a project to implement a digital care pathway for our patients with lung cancer. So we started by establishing a clinical steering committee with representation of all of the different specialties in the multidisciplinary team. We then co-designed with 6 consumers, utilising lived experience groups, followed by an iterative action design research methodology. We ensured that all of the different treatment types were represented in the group, as well as having carers and members of our cold community. Co-design proved invaluable. So just one example was when Mehmet, our Turkish consumer, said to me, "Oh, Katharine, I love that you can send me these messages in Turkish, but my daughter, she went to school in Australia, she can't read Turkish, and I'm going to need her to help me fill in the questionnaires. So I need to be able to put the messages back into English." I had thought I was being so inclusive with my multilingual pathway, but actually the solution wasn't fit for purpose. And so it just really highlighted the importance of designing with the end user, not for the end user. Our pathway is based on the International Consortium of Health Outcome Measurement standard set for lung cancer, with the addition of the patient activation measure. We developed comprehensive education and training resources, robust governance processes, and implemented a mixed methods evaluation to ensure effectiveness. So we launched our My Health at Northern app 18 months ago as an automated cloud-based platform developed with our technology partner Datos Health. The pathway is multilingual, available in the top 5 languages spoken by our lung cancer patients: English, Arabic, Greek, Turkish, and Italian. With inbuilt analytics and data visualization tools, it's fully integrated into all of our Northern Health systems, ensuring high interoperability and seamless clinician uptake. So integration with our patient administration system allows for automatic enrolment. Data is automatically uploaded into CPF and Cerner, our EMR, upon completion, meaning that our clinicians don't have to access an additional platform to see their patients' data. The data warehouse integration combines patient-reported and clinical information in meso-level service performance dashboards. Patients are automatically discharged from the pathway when death is entered, alleviating consumer concerns about posthumous messages being sent to their families. Due to the low rates of literacy, and in particular health literacy in our community, we've prioritised video content. So patients receive a welcome video, a video about shared decision making, PROMs, and then condition and treatment specific information. This ensures an accessible, user-friendly experience for all participants. So how do we know what to measure? Well, fortunately, we have the International Consortium of Health Outcome Measurement, who provide us with standard sets. So these are predefined instruments and time points that allow us to collect outcomes and benchmark internationally. We also use the patient activation measure. So this is a really key part, and it's part of all of our pathways now. So activation refers to a patient's knowledge, skills, and confidence in self-managing their health, with higher activation associated with better self-management and lower healthcare utilisation. Patients get a score out of 100 and a level from 1 to 4, with level 1 patients believing that their clinician is responsible for their healthcare, all the way through to level 4 patients who are their own health advocate. Now, lung cancer is a highly preference-sensitive condition, so understanding a patient's level of activation shapes our shared decision-making conversation. With the PAM, a single point increase is associated with an annual healthcare utilisation reduction of 2 to 3%. And at 6 months, we're seeing an average of a 6-point increase in PAM, which is significant healthcare savings for the health system. We've had over 200 patients participate in the lung cancer pathway to date, with high patient and clinician both participation and satisfaction. Data collected by the platform has allowed us to identify gaps in service. For example, the extreme psychological distress and financial burden associated with the first 6 months of a lung cancer diagnosis, and allowed us to develop data-driven business cases to address these gaps in service with additional oncology social work and psychology support. I cannot tell you how powerful and impactful this data is. It's completely changed my practice. I thought I was a pretty holistic practitioner to start with. I wanted to collect outcomes, but it's a game changer. It allows me to meet the needs of the individual in front of me, and when I see their subsequent outcome report improve, It's the most amazing feeling, and it helps remind me that what I do is truly worthwhile. And that's lovely for me, but it's actually about the patients. So this is Stephanie, a 76-year-old Greek woman, ECOG 3, 36 kilos, who came to see me with presumed stage 3B lung cancer. Referred for best supportive care, she was enrolled in the pathway and completed her outcomes. At her 2-month telehealth review, she told me she felt fine. However, her outcome report flagged severe breathlessness and severe pain. When I followed up with her, she said, "Oh, I didn't want to bother you," which was pretty devastating. A CT scan confirmed a large pleural effusion. Our pleural nurse practitioner drained 2 litres of pleural fluid and relieved her symptoms. She went home the same day. She was subsequently enrolled in a symptom monitoring pathway and remotely reported her symptoms while having nurse-led home visits with real-time remote teleultrasound back to the clinician in the pleural clinic. Reaccumulation of her effusion was proactively identified, and she was brought in for a day procedure for a tunneled catheter. All of this allowed us to move from reactive to proactive care. So what this avoided was most importantly for Stephanie not developing severe symptoms, but it also avoided an ambulance call out, an extended emergency stay and multi-day hospital admission, creating system level value in addition to personalised care. So in the last 12 months, we've rolled out digital care pathways across all divisions at Northern Health. We currently have 10 live pathways, several other under development. We've got over 500 active users and a bit of a hectic program of work upcoming for 2025. I'm super excited, my team less so. We have a standardised implementation methodology that's scalable and replicable. We are looking at, this includes implementing quality and safety meetings for those multidisciplinary teams that didn't already have that, where the data can be reviewed. We're looking to harmonise our instruments, so using the Promise 10 Global Health instrument as our generic quality of life instrument across all of our pathways, which may well be applicable in a diverse ICU cohort. Oh, and the other thing, we're working with our technology partner to translate data into actionable insights utilising AI. Following the success of our initial programs, we're rolling this out broadly across Northern Health with our program Outcomes for Impact. And this is truly designed to help us connect with our purpose in healthcare, which is to not only deliver but impact the outcomes that matter most to our patients and community. So it's a really simple strategy. It's measure what matters, use what matters, do what matters. So we're working together with our patients and community to understand and capture the health outcomes that matter most to them. Now, use what matters is where our non-clinical teams really come to the fore. So we're developing the skills, capabilities and technologies that empower our staff to translate what is measured into action. And finally, do what matters. So we're implementing, evaluating and redesigning our models of care based on data and evidence to maximise the impact on health outcomes. We believe that this transformative program is going to allow us to genuinely connect with our purpose in health, which is to deliver the outcomes that matter most. And this is going to allow us to achieve our organisational vision of a healthier community, making a difference for every person, every day. Thank you.